Understanding angioplasty, a life-saving procedure. Angioplasty is a minimally invasive procedure that opens blocked or narrowed arteries. These arteries are vital pathways that carry oxygen-rich blood to your heart muscle. When plaque builds up inside these arteries, it can restrict blood flow, leading to chest pain, shortness of breath, and even heart attacks. Angioplasty helps to restore that blood flow, ensuring your heart receives the oxygen it needs to function properly. One of the leading causes of blocked arteries is atherosclerosis. Atherosclerosis is a condition where plaque, a sticky substance made of fat, cholesterol, and other substances, accumulates on the inner walls of your arteries. Over time, this buildup can harden and narrow the arteries, restricting blood flow. This blockage can affect various arteries in the body, but when it affects the arteries supplying the heart, it's known as coronary artery disease, or CAD. Angioplasty is often the go-to treatment for individuals diagnosed with CAD, particularly those experiencing symptoms like angina or chest pain, or who have had a heart attack. However, it's not suitable for everyone. For instance, if you have multiple blockages in specific locations, or a complete artery occlusion, a coronary artery bypass grafting or KABG might be recommended instead. Your doctor will assess your individual case to determine the most appropriate treatment approach. Before undergoing angioplasty, you'll undergo a series of tests to evaluate your heart health and ensure you're a suitable candidate for the procedure. These tests may include an electrocardiogram or ECG, echocardiogram, chest X-ray, and blood tests. These assessments will provide your doctor with a comprehensive understanding of your heart's function and the severity of your artery blockages, allowing them to tailor the procedure to your specific needs. Preparing for your angioplasty tests and lifestyle changes. Your journey to a healthier heart begins even before the angioplasty procedure. Preparation is key to a successful outcome. Your healthcare team will guide you through the necessary steps, which include a series of tests to assess your heart health and readiness for the procedure. An angiogram, a specialized X-ray that uses dye to visualize blood flow in your arteries, is often performed. This imaging test helps doctors pinpoint the exact location and severity of blockages. Based on these findings, your cardiologist will determine the best course of action for your angioplasty. Leading up to the procedure, your doctor might advise you to make important lifestyle changes. These changes are not just about preparing for the surgery, they're about adopting a heart-healthy lifestyle for the long term. Quitting smoking is crucial, as smoking damages your arteries and increases the risk of complications. Additionally, you'll need to modify your diet, focusing on heart-healthy foods low in saturated and trans fats, cholesterol, and sodium. Incorporating regular exercise into your routine is also essential. Physical activity strengthens your heart, improves blood circulation, and helps manage weight and stress levels, all of which contribute to a healthier cardiovascular system. The angioplasty procedure, a step-by-step guide. On the day of your angioplasty, you'll arrive at the hospital and be prepped for the procedure. A nurse will insert an intravenous or IV line, usually in your arm, to administer fluids and medications. You'll be given a mild sedative to help you relax, but you'll remain awake and responsive throughout the procedure. The procedure itself is performed in a specialized cardiac catheterization lab. A local anesthetic numbs the area where the catheter will be inserted, typically your groin or wrist. A thin, flexible tube called a catheter is then inserted into the artery and carefully guided to the site of the blockage using X-ray imaging. Once the catheter reaches the narrowed area, a balloon at its tip is inflated. This inflation compresses the plaque against the artery walls, widening the passage and restoring blood flow. In many cases, a stent, a small, expandable metal mesh tube, is permanently placed in the artery to help keep it open and prevent future blockages. After the procedure, the catheter is removed and the insertion site is bandaged. You'll be monitored closely for a few hours to ensure there are no complications. Most patients can return home the same day or after a short overnight stay, depending on their individual case and recovery progress. Life after angioplasty, recovery, and long-term care. After your angioplasty, you'll be prescribed medications to aid your recovery and prevent future blockages. These may include blood thinners like aspirin or clopidogrel, also known as Plavix, to reduce the risk of blood clots forming at the stent site. It's crucial to take these medications exactly as prescribed to ensure optimal healing and prevent complications. While angioplasty is highly effective in opening blocked arteries, it's not a cure for atherosclerosis. Therefore, adopting and maintaining a heart-healthy lifestyle after the procedure is crucial for long-term success. This includes following a balanced diet low in saturated and trans fats, engaging in regular physical activity, managing stress levels, and quitting smoking if you haven't already. Attending cardiac rehabilitation can be incredibly beneficial during your recovery. Cardiac rehab provides a structured program of exercise, education, and support to help you regain strength, improve your heart health, and reduce the risk of future heart problems. It also offers a supportive environment to connect with healthcare professionals and others who have undergone similar procedures. Remember, your health is a lifelong journey. By actively participating in your recovery and embracing a heart-healthy lifestyle, you can significantly reduce your risk of future heart problems and enjoy a healthier, more fulfilling life.